Hey everyone, I just wanted to give you a few helpful hints as you start testing your knowledge and you start trying to apply these principles of biomedical ethics. So one of the first things you should have realized as you're reading is that all of these principles harken back to the ethical theories that we've already talked about. It's pretty cool. All of these principles are deeply rooted in those big three theories that we talked about. So see if you can figure out what theories link up with which principles, vice versa. It's a good intellectual test, so have at it and good luck. Now, let's talk about how to actually use this framework, okay? So there was that strange Latin word you probably came across in your readings, prima facie. Now, what that means is essentially as it seems at first glance or at first sight. So sometimes in the clinical setting, we have issues that occur where it's so plainly obvious which ethical principle is breached. For example, if a physician cuts off the wrong finger or amputates the wrong finger, we clearly see that as negligent, which is an obvious breach of the principle of non-maleficence. Pretty open and shut case, so to speak. But there are other cases that are a lot more complex, and that requires us to balance these principles, because sometimes these principles can appear to conflict. So, for example, we often want to abide by the patient's preferences, right? We want to follow that principle of autonomy. But sometimes patients elect to do things that are harmful, which would cause a breach of the principle of non-maleficence. So what we have to do is we have to balance those principles, the principle of autonomy versus the principle of non-maleficence. In those cases, what we do is we try to generate the strongest arguments that we can on both sides, and then evaluate those arguments and see where the strongest case lies so we can actually draw a conclusion about what to do in that specific case. So this takes a lot of practice. So the first step in mastering this is to make sure you are very comfortable with the definitions of the principles, the scope of what each principle encompasses, and then you can start to applying them one at a time, and then you can go on to take them into contention with one another. So I hope you found this helpful. Good luck.